Huples cat. Welcome to a very sunny north of Toronto. I'm going to do edited excerpts from a town hall from my hospital. It was done on the 27th of February, and I'm going to actually just put out the important points to it, and I'm also going to give you a little bit of interpretation of what I think about what they're saying. I think right now the sensible plans that most of us are doing remain in place. If you haven't shaved at this point, you really are insane. It is community-based and it is spreading. And there's also some really worrying signs, but I'll save that for another video.
This will become a pandemic.
But when you look at the overall, what is happening overall across the globe, it's very clear that we're not dealing with just a sporadic number of cases, a small number of cases. We're dealing with really what is called a pandemic. And now, while I realize the WHO hasn't made an official declaration of this being a pandemic, I think for our purposes, we for several weeks have been planning or had the mindset that this will become a pandemic.
Which is of course an important definition. And obviously the definition the World Health Organization had, this is a pandemic. And I've been saying for a while, this is a pandemic. So are a lot of virologists and epidemiologists across the world. And I think it's important to understand that. SARS in 2003 was an epidemic. There was outbreaks outside of China, notably in Toronto, notably in this hospital that I work in, that these people are talking from. And it didn't actually go into pandemic phase. It didn't really get into the community anywhere else, particularly a few places, but very few places, and it was able to be contained. That's because of the nature of the virus and how it was able to transmit and its lifespan. What we're looking at right now is a coronavirus similar to MERS, similar to SARS, similar to a lot of other coronaviruses that actually is unique, it's novel, and it's operating in a different way, and we're still learning how it operates. But what is clear on March the 1st, 2020, is it is spreading like flu.
So, you know, at the global level, the reality is that this virus hasn't been contained. And so I think that in Canada, we can expect that with time, that will be the case as well. And so when we talk about a pandemic, we're really talking about the virus spreading across the globe and across countries, and being no longer something that is just imported into a country and identified and isolated and contained, but rather something that is actually spreading locally within communities. COVID-19 is going to be a pandemic. It's a near certainty. But in a pandemic situation, the reality is COVID-19 will be circulating in our communities and will no longer be able to prevent all infections. It's just not possible. And I think that is something that's scary to talk about, but I think a reality in terms of our thinking, where we go from promoting containment of the virus to actually really just mitigating its overall impact and doing everything possible to protect our patients and to protect our staff.
So that's obviously a really important point. When, not if, COVID-19 becomes pandemic and locally spreading within the community, which it's already doing around the world. I think Britain actually exported it to China or Hong Kong today. It's going to be a reality, and we have two choices. We either fight it by hand washing, appropriate use of masks, social distancing, shutting down most of the parts of the economy for a period of time and accepting the financial loss to prevent spread, or we just go, oh well, some people will die and carry on. And that's one of the important points, is that the death rates with this are significant. It is not just old, sick people that get it. They appear at the moment to be getting it more than anybody else. But I would argue right now a lot of the cases are starting in area hospitals around the world, and therefore that's why you're seeing a lot of old people. China's suggesting that 10% of cases are children. That's significant. Now, where we go from that, I don't know exactly.
So we've shifted from containment to mitigation. The pandemic isn't here now. You can't add all countries as countries of concern, clearly, and you need to deal with the reality that people could walk in with viral respiratory symptoms, and COVID-19 could be actually the cause, even when someone hasn't traveled.
So that's the thing. although it's a human thing, I don't want anybody coming here from China, or I don't want anybody coming here from Iran. You can't actually close down all entry to a place and think you're going to be safe. It's going to get in somehow. Container shipping, somehow or other, it's going to get in. What they're doing is trying to slow the spread as long as they can to try and get ready to deal with the pandemic phase where it's spreading in the local community.
Is our emergency departments are starting to see more and more visits for people that are concerned about COVID-19. And as the number of countries expands, there's a larger group of individuals concerned about COVID-19. And, our messaging has been very consistent, which is that, hospitals aren't the right place, for people with that are concerned about COVID-19 to come and get tested if they're otherwise well and don't have an acute medical illness. And so we're trying to work with the ministry right now to try to look at planning outside of hospitals in the community in terms of working with public health partners to make sure that we have the infrastructure in place and can obviously look after the patients with acute medical illness, because otherwise the other visits could overwhelm us and, of course, affect the access of care to the sickest patients that we need to care for.
So 2 points here. He's absolutely right. We're seeing quite a large number of people coming saying, I think I might have this, test me please, test me. None of them are being tested right now unless they actually come from the hotspots and have been there within 14 days and have symptoms. So if you come from the hotspot within 14 days and you don't have symptoms, we're not testing you. So we are possibly under testing. And one of the things is they're going to increase testing. Now, but they're only going to test people that are symptomatic, which is the interesting part. The other part here is that Canada at the moment, March 1st, still has not got the ability for people to phone a number, go and get tested outside of the acute healthcare system. That is terrible.
And whether the current model is actually sustainable when you think about a circumstance where you have a broad number of locally acquired cases.
And of course it's not sustainable at all. During SARS in 2003, it was just basically a few hospitals in Toronto that were affected in Canada, so we had the resources of Canada's health to help us out. In a widespread locally acquiring infection that's across Canada, across North America, each hospital, each health district, each province will be essentially on its own to a large degree. We're not going to be able to get extra supplies and extra staff from elsewhere. There's a hospital in Italy right now that has 89 patients on ventilators. I can't imagine how awful it is to be there, but the other hospitals around them don't. And that's a critical thing. If every hospital in Italy has 89 people on ventilators, a lot of people on ventilators are going to be turned off or just going to die on the ventilator by accidental disconnection. There's not enough trained staff. There's not enough single-use plastic hoses equipment to deal with that quantity of patients that require ventilation. So the current model isn't sustainable. It's also not sustainable to provide staff with N95, because to prepare for the pandemic, what most governments did, including Canada, is they filled warehouses full of Tamiflu, which is now expired, and Tamiflu is no use at all in this particular strain of virus. They didn't fill warehouses full of N95 masks, apparently, and that seems to have been an error. And no government, as far as I know, is actually crash building factories to produce N95 masks. That should have started about 2 to 3 weeks ago, and it should be really a big focus is to actually provide people like me the equipment I need to actually look after somebody who's sick with COVID-19. And the sensation that I don't need an N95 mask because whatever, these people who are millennials who didn't work through SARS, I'm sorry, I'm not going in the room.
First, we're broadening our testing abilities, and we're looking at doing testing really for a broader number of patients than just our persons under investigation.
And that's good. I think it should have happened about 2 weeks ago. Currently, unless you've actually been to 12 countries within 14 days or had very, very close contact with somebody who's been in one of those 12 countries, and you have viral pneumonia, they don't get tested. So, for example, somebody could come from Beijing 16 days ago, have viral pneumonic symptoms, all the symptoms of COVID-19, they're not tested, they're sent home and not followed up. And I think this is probably why there's going to be local spread community. They've stuck to this 14-day period, and they're very firm, though they have no idea exactly what the length of incubation period is. Obviously, there's been a lot of ideas that the incubation period could be up to 29 days. Obviously, to quarantine everybody for 30 days seems a bit extreme, and to test everybody who's been in China or Iran and the other 10 countries, Italy, within the last 30 days would be very, very expensive, and we didn't have enough test kits initially. So that's one of the factors, is that we're not testing people that might have COVID-19, and we know that, and we know that from other countries' experience, once it gets hold in the community, it spreads, and eventually you get a sudden explosion upwards of very sick cases. Grumbling, 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 boom. And as you probably noticed, I remained sick. I'm now into day 12 of having viral pneumonia symptoms. However, I would not be tested, even though I work in a hospital that has had COVID-19 patients, even though I have been literally outside the room of those patients on more than one occasion.
As we prepare and shift from these small number of sporadic imported cases to a larger number of locally acquired cases in a pandemic scenario.
That's it for this one. There will be another one probably tomorrow or the next day. There is more from this town hall that's important, talking about which type of hand sanitizers don't work as compared to which kind of hand sanitizers do work. And I also have some advice for you if you have alcohol as a hand sanitizer to actually make it work. But right now, if you're out about in the public, have the ability to fit an N95 to your face at any time somebody close to you can't get away from has got obvious flu signs. Okay? Have one on you at all times, and every member of your family, and put it on if you can't just quickly move away from them. Make sure that if you're touching stuff other people have touched, you've got disposable gloves on, and or you have sanitizer that's yours that you can use before and after. Before, because you might be infected, right? But definitely afterward. And consider not going out, not traveling, not going to stores when it's crowded.
Man, Walmart right now is packed. I just came back again after going to Sam's Club for an hour or so.
Right now, there is definitively, in many places in North America, panic buying starting to occur. It's not true panic buying yet, but I imagine it's going to come to it soon. Right now people are going out there and they're just buying all the N95 masks, obviously, and all the surgical masks and all the hand sanitizer and all the bleach. They're also buying a lot of camping stuff as well. So considering online food ordering from a camping and hiking equipment if you want dehydrated food in the house. Right now, try and think a little bit outside the box. You need to have 2 weeks food in case you're quarantined for 2 weeks at home and you can't leave. I would argue you need at least a month's food in addition to what you normally have in the home in case this goes on for 2 or 3 months. And I would actually prefer it, if you can, to have the ability to feed yourself as well as you can for 3 months. This could go on for 6 to 9 months. Obviously there will be food. People obviously won't be starving to death, but people are going to get hungry. People are not going to get great food. And it's going to be a very tough time. If we do get local community spread throughout North America and Europe, everything is going to shut down. The economy is going to go into absolutely deep freeze. As much as I don't want it to, as much as I'm still hoping it will weaken, what I'm seeing is it strengthening in its infectivity and its effects. Anyway, more on this later. I'll just put up some video at the end of the doglets because the dogs enjoyed the snowy day. If you've got any questions, ask me below. If I don't know, I'll tell you I don't know. Stay safe, be prepared as well as you can, keep a sense of proportion. Almost certainly, everybody watching this video won't die from this. Well, 2% of us that catch it will. Doodles! So far, the terriers are completely unaffected by it. This has been a Bad Terrier 2020 production. Definitely go for a walk today.